Janet is really the matriarch of cancer genetics. She was the pioneer in the field. At the University of Chicago, I think she's been really inspirational. She's always promoted the area of discovery science. One of the greatest legacies that Janet has had is to help us understand that cancer is not one disease. She's had an enormous impact on the field, not only opening up a new field, but her work has led us to the area of personalized medicine.
Cancer is really the biology of a cell gone wrong. We have to understand what's gone wrong at the most fundamental level.
The place to start is on the smallest possible level, on a molecular level. Janet's sort of persistent observation and recognition that the chromosome abnormality was not just a random event, not just the result of the cancer, but was in fact the cause of the cancer, that has opened up this entire field of molecular biology as it applies to cancer.
Molecular diagnostics is the technology by which we examine each person's tumor and identify the key genetic mutations in that tumor. We've learned from Janet's work that cancer is characterized by changes in our DNA. And the reason that's important is that it's those mutations that are the Achilles heel of the cancer. If we can target the effects of those mutations and counteract the effect that they're having on the cells, then we can revert the cell back to a more normal growth pattern. That means that we need to develop unique approaches to treating each patient's cancer.
For some of those patients, we can really treat them in ways that are miraculous, because instead of looking at an average life of 3 years after you're diagnosed, data from studies indicate that you have an 80 or 90% chance of being alive at 5 or 7 years, and that's dramatic.
We have more new and effective treatments available than at any time in human history, and we are just getting started. As we learn more and more about cancer, as we develop better and better tests, and as we develop more effective and less toxic drugs, cancer care is going to continue to be revolutionized. And we're going to move from a time when patients get treated with toxic intravenous therapies with terrible side effects that ruin their quality of life, to a time when the typical cancer patient gets a pill, more likely a few pills, that they'll take every day in a combination therapy that will keep their cancer under control with minimal side effects and allow them to continue a normal life. Let me give you an example of the power of the molecular diagnostics approach. A young man, never smoked, had an advanced form of lung cancer. My colleague, being a lung cancer expert, recognized that sometimes young men who don't smoke and get lung cancer have a lung cancer that's caused by a specific genetic abnormality. We obtained a biopsy of the patient's lung tumor. My colleague actually was able to take that biopsy and study it in his laboratory and determine that, in fact, that lung cancer had a mutation. We had a clinical trial available here that patient could participate in. The patient came, had the biopsy done, had the mutation analyzed, enrolled in the clinical trial, and within weeks the cancer began shrinking.
What is spurring the field right now is that new technologies to sequence the genome have emerged. They're often called next generation sequencing. It is possible to apply powerful technologies to document the changes, identify the changes, and then use them to develop very targeted therapies.
I think that molecular diagnostics is not only going to be able to help us diagnose and treat cancer better, I think that it's going to be able to help us prevent some cancers. And it's certainly going to be a valuable addition to early diagnosis. One example is pancreatic cancer, which, as you know, is a very aggressive disease. Molecular diagnostics is going to be able to help us profile early lesions and identify early genetic changes that predict which of these lesions may progress to pancreatic cancer. And that will then allow us to identify interventions or therapies.
We need to recruit top-notch people, scientists who really understand the promise and the challenge of molecular diagnostics.
We would have to invest in computational biology, we would have to invest in next-gen sequencing technology, we would have to invest in excellent clinical care.
Molecular diagnostics is going to be critical in early diagnosis. So if I had to make an investment, I would invest in both imaging technologies, medical imaging technologies that can help us identify tumors early.
All of this creates a huge amount of information. It's all information. So the informatics capabilities that allow us to collect and integrate all this information are absolutely vital to our success going forward.
This university from its founding has been based on the premise that important problems require a multidisciplinary approach. And I think we have all the elements of that multidisciplinary approach on the same integrated campus.
The university has a number of advantages, and one is its relatively small size. People who are doing much of the work really have laboratories that are just across the street or next door to the hospital. Physicians in the hospital, many of them have their own research laboratory so that they can go from seeing patients, go back to their lab or a colleague's lab and work together. That's very rare.
The molecular diagnostics laboratory and division within the University of Chicago is going to be the bridge. They're going to be the bridge between the basic science laboratory and the clinical operations. And I think how we treat cancer 5 years from now is going to be completely different than what we do now. And molecular diagnostics is going to play a very key role in this.
And the return on this investment will be measured not in dollars and cents, but in improvement of human life.